Exploring this whole system perspective, this model, which I first developed some 20 years ago, illustrates the balances involved in implementing a healthy settings approach, holding a number of aspects in tension, identifying gaps and addressing needs, but also mapping good practice and celebrating and building on strengths and capabilities, investing in long-term, behind-the-scenes organisation development to achieve whole system change, while retaining a high profile through managing innovative and visible projects, securing top-down leadership alongside bottom-up empowerment and rule-based ownership, and anticipating and responding to health promotion concerns, whilst also being driven by and contributing to core higher education priorities. A further model illustrates what it means to view the university as a system and to connect between different parts of the whole. A whole campus approach will mean appreciating, mapping and developing linkages between different groups of people, between different topics or issues, between different elements of the system, and between different policies.
So a key element in the Healthy Campus Charter and Framework is a whole campus approach. So I guess in terms of the Healthy Campus Charter and Framework, there are 4 pillars. These are leadership, strategy and governance, the campus environment, which includes facilities and services, campus culture and communications, and personal and professional development. And in this context, personal and professional development relates to teaching and learning, as well as like staff development. The framework acknowledges the lack of evidence on healthy campus per se, but it is possible, again, as we've already stated, to draw on learnings from educational settings that holistic, multi-component, whole campus approaches are more likely to be successful than isolated and fragmented activities. This is where our 4 pillars come into play, and this is where this is important, I think, in terms of guiding your work. So to help make some sense of the complexity that is a whole campus approach, we want to focus on mental health and wellbeing as an example of a health topic and how that might look in terms of a whole campus approach. And obviously when we take a health topic area, there's plenty of evidence around interventions in terms of the student and staff population in an institution. So the HEA National Student Mental Health and Suicide Prevention Framework was published in 2020 by the HEA and offers guidance to higher education institutions on supporting student mental health and suicide prevention. So the framework can really support your healthy campus work, and it should form one part of an overall approach to student and staff health and wellbeing. So the framework calls for the approach to improving and supporting student mental health to take a whole system collaborative approach based on empirically backed practices. This is not the job for a single unit or department. Mental health needs to be, as quoted, through institutional changes at all levels and into the university culture, creating horizontal cooperation and decision-making, participation and cooperation across sectors and departments. Unquote. Treatment approaches on their own are not sufficient to improve population health and wellbeing. There needs to be a comprehensive public health approach, embracing promotion and prevention alongside treatment and recovery. A settings approach to mental health needs to consider the continuum of care, looking at interventions across the individual, community and population levels. It's important that we reframe our approach to mental health and wellbeing. The American Council for Education developed a report based on a comprehensive review that gathered information on evaluating the effectiveness of campus interventions from a range of academic fields and journals. The report summarises findings from that paper along with key recommendations to help higher education leaders make evidence-informed investments in student mental health. Now, this is specific to a US context, but I think there's great learnings that we can all take in terms of a healthy campus approach. So the 5 recommendations were to use data to regularly assess population level needs, priorities and progress. And I guess you'll notice when you think about the healthy campus process, where we ask institutions to do a needs assessment and to look at the data that's relevant to your students and staff, you'll kind of see some synergies between this. Invest substantially in strategies with proven effectiveness, revise or discontinue strategies with proven ineffectiveness, invest modestly in strategies with promising evidence, then evaluate and reassess. And number 5, contribute to a broader movement towards an evidence-informed approach to student mental health. And I guess reflecting on these 5, there's nothing, I guess, that doesn't make sense in that. And we also see the importance of data and having the evidence base. And I think that's also really important if you were thinking about, establishing something within your institution, the importance of the evidence, because you can see that all of these decision makings rely on evidence. The report noted that college institutional leaders can often respond to the levels of mental health illness by increasing the availability of mental health services, such as counselling. Increasing the availability of mental health care is helpful, but it's not sufficient, which many campus communities recognise. Rather, this approach should include a wider range of resources and efforts to promote mental health and well-being among all students. This type of public health approach recognises that mental health is dynamic and can be improved not only through treatment delivery, but also social, economic and institutional factors, such as including a sense of belonging, financial support, campus climate and policies. Such a public health approach should not replace traditional mental health services. And finally, the report noted that although most robustly evaluated strategies focus on the individual student, campuses and institutions have important opportunities to support student mental health through improvements to the broader campus environment. The HEA commissioned the development of a Healthy Campus self-evaluation toolkit to enable institutions to implement and evaluate the Healthy Campus Charter and Framework at a local level. So this includes supporting you to implement stages 3, consult, 4, create, and 5, celebrate and continue of the Healthy Campus process. A project team led by Professor Catherine Darker of Trinity College Dublin, in collaboration with colleagues also across Trinity College Dublin, the University of Limerick, Munster Technological University and University College Cork, have developed the toolkit. Now, the toolkit aligns to the whole campus approach outlined in the Healthy Campus Charter and Framework, and it refers to these as pillars. So pillar 1 is looking at leadership, strategy and governance. Pillar 2, looking at the campus environment, facilities and services. Pillar 3, campus culture and communications. Pillar 4, personal and professional development. Now, the toolkit project team have also included a 5th pillar, which includes health-focused areas. And I think the toolkit is going to be a really important piece in defining what we mean by a whole campus approach and what we're expecting to see across all 4 pillars, and how you can do a self-assessment to see where your campus is at and what change would be most relevant in the context of where you're at. And it's always about starting and meeting where you're at. It's never about it's not about running the marathon, it's about getting out for a jog if that's where you're at. And I guess in separate to this, in the UK, they have a self-review tool similar to this. And Professor Mark Dorshoff, whose research you're going to see a lot throughout this course, he's an emeritus professor in health and sustainability at the University of Central Lancashire. So he did do some research on their self-review tool. And what he found, some of the benefits or some of the kind of outputs or benefits to those working on Healthy Campus included a deepened understanding of a whole systems approach. It provided a catalyst for cross-university and cross-sectoral collaboration and partnership. And the idea of benchmarking was a motivating factor to doing the self-audit. And finally, I guess as advocates and leaders for change in the area of health and well-being, it's important to consider our work in terms of multi-pronged approaches, and understanding that taking a singular approach alone won't lead to sustained population change. That's not to say programs or individual approaches aren't important, but when it comes to action planning, we must consider multiple actions across the pillars of a whole campus